The title of my talk was Academic Leadership and Work-Life Balance. When I started working with the presentation, I wanted to change it to leadership at an academic hospital and work-life balance. So that is what I will focus on. And first, some words about myself. I'm born and raised in Reykjavik in Iceland, and I realized that I have had a. Did my?
Yeah, ma'am. Please share again. There was some.
Yes, there's something that happened. Here we have it again. I just told you I was born and raised in Iceland. A great privilege to be raised in a peaceful country, especially now when we are seeing a horrible war in the northern part of Europe. And it was a privilege to have a governmental paid education, being able to choose whichever academic career I wanted. And I chose to be orthopedic surgeon. I was supported by a lot of colleagues. And in 1996, I moved to Sweden to continue my education. And I live in Lund. Lund is in the southern part of Sweden, and we have this Skåne University Hospital. This is a tertiary hospital and a complete orthopedic department with 500 employees. And this is the main building in Lund, and then there's a picture from the university, which is a very important part of Lund. In my career, I've been an orthopedic surgeon since 1998. I've been working clinically with rheumatoid patients and prosthetic joint infections. I've written a thesis about the infected knee arthroplasty, and I have really enjoyed working at the university hospital, being able to combine the clinical work with teaching and scientific work. And I've been working both nationally and internationally with infective prevention. Since 2017, I have also had a leading position, first at the arthroplasty unit, and since September, I had the position of being a head of the whole department. And that has been a great experience. There are a lot of challenges. I think that's all over the world. The challenge is being in lead of a large department. And even though Sweden is a rich country, there is this imbalance between the demands and resources. It's partially related to demographics and new treatments, and the COVID pandemic has accelerated all these challenges. Our main problem is to recruit and retain personnel, and we have more and more competition with the private hospitals that are doing the easy operations. And that leads to a frustration among surgeons, and there is a never-ending work with the challenges with work-life balance. But it's also a lot of rewards. You have the ability to have an impact, to have a possibility to change. You get a lot of contacts and information, and sure, you can be very proud of all the good work that has been done, and it surely is important for your personal development and being a better leader. How does that go with the work-life balance? I actually hadn't thought so much about exactly what is the work-life balance. I looked at some definitions, and I found this from the Canadian government. And at the end, it says that work-life balance supports physical, emotional, family, and community health without grief, stress, or negative impact. And it also says that it is self-defined and self-determined. And I, in a part, want to question this. Another definition that I actually find more more related to my personal experience, that the work-life balance is the individual perceptions of work and non-work activities, and they are compatible and promote growth in accordance with an individual's current life priorities. And I found this new paper. It's actually from India about work-life balance. And I think it shows that it isn't only the individual decisions that affect the work-life balance. You have all the individual factors like gender or age. You have your ability, your physical and psychological ability, what you demand of yourself, how your family is and what support you get. And it is so much affected about the organizational factors, like the working hours, what support system you have in your healthcare, how much you can affect your job and your job satisfaction, how the culture is, how the culture is dealing with, as an example, female orthopedics and productivity. And you also have to look at the society, the culture, how it is the culture, who is taking care of the parental work and the housework, what demands do you have and what support. And then I've been very lucky to be in Sweden, when you have very good child care, just to mention an example. And what works for me, it comes with experience, and that you will find it will work out. You don't have to panic. You've been in so often in the position, you have a lot of workload, but you know it will manage. Rely on the facts, take it easy, be authentic, be yourself in all situations. Be kind with the personal relation and be respectful to everybody you're working with. Just make it simple. I find cooking and gardening as very relaxing things to do. And the holy dinner, I want to have the whole family with me eating in the evenings. Also to do other things. Music is very important to me, playing the piano, singing in a choir, and taking care of yourself with both motion and sleep. And to have the opportunity to go to nature and to get a new energy. And then I usually go to Iceland with my whole family, just some picture with the whole family going for a hike and having the children gather afterwards. That's really what is important, to be able to combine with the work at the clinic. Thank you very much.